This recording will go over week 5 homework and provide a little information about the exam. Again, exam 2 will be on Monday, this Monday, the 22nd at 8 a.m. Classroom assignments are the same, listed on the weekly plan, and will be posted on the door. Most of you guys got through the ATI pain and inflammation module and test without many issues. I just wanted to remind you that you are able to take the test more than once. So if you want to take it over and over again for practice and to review the rationales that are being provided, you can do that. There's no problems with you doing that. The true assessment of your knowledge, though, is that first score. So, if you get a low score that first time you take it, it is good for you to retake it to help reinforce those concepts with you, but that first test score gives you an idea of where you are in terms of knowledge of that content and being able to apply it. Before I give you chapter 24 and 25 answers from this week's homework assignments, I don't think I gave you the chapter 21s from the previous week. So go ahead and pause the video and compare your answers to the chapter 21 answers. And go ahead and pause the video to compare your answers to the chapter 24 answers. And here's the rest of the chapter 24 answers. And the chapter 25 answers. And here's the rest of the chapter 25 answers. So if you're going over these and comparing your answers to the correct answers and you don't understand why an answer is correct or the rationale of why an answer is incorrect, please email me and we can go through it together. There were some great submissions for the compare and contrast assignment. So some people wrote out sentences, some people grouped information in paragraphs, some people made charts, a lot of people used color to highlight things. So I'm just going to go over a couple submissions that organized the information nicely and I thought were easy to follow and study from. So the first thing was to compare aspirin, ketorolac, ibuprofen, acetaminophen, and celecoxib. And the big thing this student did is they highlighted all the NSAIDs here in green and then listed the classifications. So the classifications are different, but they're all listed as NSAIDs. So aspirin is an NSAID, ketorolac NSAID, ibuprofen NSAID, celecoxib is an NSAID, but this one is different from the others, right? So I'm not sure, it's not listed here, but you should know that aspirin, ketorolac, ibuprofen, they all affect COX-1 and COX-2. This celecoxib is a COX-2 inhibitor. And the benefit of that is you have less GI distress, less risk for GI bleeding, because those NSAIDs that affect COX-1 and COX-2 put the patient at risk for GI bleeding, peptic ulcer, bleeding, right? So it's over and over again, the GI issues and the bleeding. When you get to the selective COX-2, GI issues are going to be less because the COX-2 is specific for inflammation and pain. Acetaminophen is also, the big thing about acetaminophen is that it's not an NSAID. So when we talk about how are these pain medications different, why is a physician ordering one versus the other? Is it that they don't need an NSAID, just need a non-opioid analgesic, or do they need some sort of anti-inflammatory also, hence an NSAID would be ordered? Then if it's an NSAID, is it affecting COX-1 and COX-2, or is it celecoxib that's selective for COX-2 only, and what does that mean for the patient? Another thing here, the student has highlighted or made a different color, hepatic disease. Hepatic, you see that HEPA, you should think liver. So the acetaminophen can cause issues with the liver. So we're going to monitor hepatic enzymes, right? Monitor those labs that represent liver function. So do you know what labs we talked about at the beginning of the semester? Do you remember what the normal values are? Those you need to, if you're rusty on those, you need to review them again and be familiar and comfortable with those. So your other part of compare and contrast was I had a typo and had put celecoxib versus allopurinol. What I meant to put was colchicine versus allopurinol. So colchicine, what you need to know about colchicine, is an anti-inflammatory gout drug, and it's used to alleviate acute symptoms of gout. So when you think of colchicine, think of alleviating acute symptoms. And it's important to know that it does not inhibit uric acid synthesis and does not promote uric acid excretion. So a lot of students hear gout, they think uric acid, so colchicine must do something with uric acid. Doesn't do anything with uric acid. It's an anti-inflammatory gout drug that inhibits the migration of leukocytes to the inflamed site. So colchicine, acute symptoms of gout, doesn't do anything with uric acid. It inhibits, it's an anti-inflammatory gout drug that inhibits the migration of leukocytes to the inflamed site. So then you have allopurinol, which is used to treat gout. One thing here, so not an NSAID, the student has it listed as an anti-inflammatory, but it actually is not an anti-inflammatory. So not an anti-inflammatory. How does it work? It inhibits the final steps of uric acid biosynthesis, therefore lowering serum uric acid levels. So allopurinol does actually lower uric acid levels. This drug is frequently used as prophylactic to prevent gout. It can also be used for chronic gout, so it's the drug of choice for chronic. So where colchicine was acute, allopurinol is chronic. Increased fluid intake is recommended when taking this medication. She has here contraindications. We're watching for renal and hepatic disease. So again, renal, kidney, hepatic, liver. Do you know your lab values? If I have a patient who was just diagnosed with gout, would I expect their uric acid levels to be elevated? Yes, I would. If they're just newly diagnosed, they haven't taken any medication yet. For you, the nurse, you need to know, again, which labs you're looking at to see how kidney and liver function is going. So you want to keep that in mind when studying. This chart by another student just highlights again some of those big important concepts of these different medications when we're talking about compare and contrast. Who's not an NSAID? Acetaminophen, not an NSAID, not anti-inflammatory. Is it inhibiting COX-1 and COX-2? Yes, yes, yes. Celecoxib is only COX-2. Acetaminophen is not doing anything with COX-1 or 2. Hepatotoxicity, are we worried about hepatotoxicity? And again, acetaminophen, what is your maximum daily dose for acetaminophen? Do you remember that? If your patient's getting high levels of acetaminophen, we're worried about how the liver is going to tolerate that. So we want to watch those liver enzyme levels. And here's another example of a student who used color to help point out important information about the different medications. Looking at her acetaminophen, we have here alcohol use. So why do you think alcohol use, acetaminophen is contraindicated in the patient who's an alcoholic or using alcohol? It goes back to that liver function, right? We know alcohol is bad for the liver. Acetaminophen can be bad for the liver, so that is why acetaminophen would be contraindicated in a patient who has problems with alcohol. Why is ibuprofen contraindicated with bleeding? Right? Because ibuprofen itself, because of that COX-1 being inhibited, is going to increase bleeding. GI distress here, side effects of aspirin, ketorolac that are listed. GI bleeding on that one. And again, it's because of that COX-1 being inhibited. And then finally, you had your week 4 discussion board post, which went into week 5 for you to be able to provide answers to your initial questions. If you only posted your questions, posted your answers, and didn't look at any other ones, you're doing yourself a disservice. So when you're studying, you should go through all these, right, as a review. You got basically, guys created for yourself a sort of study review. So be sure that you review all these as part of your studying because they do go over some important information that you're likely to see again in the future. And then a reminder that exam 1 remediation, if you were assigned remediation, is due by the 21st at 11:59 p.m. There is a drop box for your submission. I encourage you to get that in as soon as possible. If it is not in, you're not going to be able to test. If you have any missing assignments, I've emailed you and you need to submit those or else you will not be able to test. You'd have to complete the assignments, complete the remediation, schedule a makeup test time with me, and have a 5% deduction. In terms of the exam, I also want to remind everyone to bring a working, simple calculator with them. So I always say to have 2 of those cheap dollar store calculators because they're cheap. One of them is going to quit working at some point. But you want to make sure that your calculator is working prior to the start of the exam. Please don't get started in the exam and realize it doesn't work and don't have a backup calculator. Come prepared. Calculators also need to be very basic. They aren't allowed to have a memory function. So if you're using a calculator that allows you to save information or program in formulas, that type of thing, that's not allowed for nursing exams. So please make sure you have a basic calculator, the type of calculator you'd buy at the dollar store. I recommend that you have 2 and that it doesn't have a memory function. In terms of math also, your math answers need to be on the back of your answer sheet. So if they're not listed on the back of the answer sheet, you're not going to get credit for it. I'm not going to go back to the test and see what you wrote on your test. All your answers have to be on the answer sheet. Math has to be labeled correctly to be correct. If you can circle the math answer, it makes it easier for me when grading. And then one last thing about math. So when writing out a math answer, which of these 3 options is written out correctly? So if you picked the top answer, that is the correct answer. You don't want to use commas when writing out your math answers, numerical answers, because especially handwritten, a comma can appear to be a decimal, right? And that can lead to errors. So do not use commas when writing out numbers. And also we do not use trailing zeros. So I would eliminate the decimal 00. The correct way to write 1,000 milligrams is this top way right here. So I'll leave you with a little acetaminophen meme. Hopefully this makes sense to you. If not, email me so we can discuss it. But again, good luck studying. If you have any questions or problems while studying, please let me know.